Busy people and lots of yellies, Worcester hipsters and fed up townies. We have more than pizza in common, with two rocks for bookends. New Haven, New Haven, New Haven, between two rocks.
All right, and welcome back to the Between Two Rocks podcast. It has been at least a week or two since we recorded this.
10 days.
10 days.
Mm-hmm.
No, it has been months since we did one Zoom episode in, I don't know, March?
Mm-hmm.
Sure. And then we had an episode in November.
Yeah.
And I feel like we were different people then. But yeah, now we're back. We're back downtown at Baobab Tree Studio.
Mm-hmm. Feels great. Closed off street here.
Oh, that's
looking
right,
very
yeah.
festive. COVID's over. We
That's
all
right.
agreed on
COVID's
that.
over. Everybody fuck each other, but wear condoms still.
Did everybody stop having sex during COVID?
I don't know. I mean, I did and I didn't, so
Yeah.
it's hard to say.
Had nothing to do with COVID.
Yeah, no, it certainly doesn't help. Like, it's certainly hard to date, like when you don't really feel safe in a restaurant.
I would imagine. Yeah.
It's like, hey, you want to go on a hike? I mean, I won't murder you, but you don't know that.
Yeah. Is that just generally a problem when you're inviting people on hikes?
I mean, if I was a lady, I certainly would be a little bit wary of going off in the woods with a stranger.
Yeah.
So,
Elizabeth, do you know that when guys are walking behind a woman on the street, like I feel awkward that a woman might be thinking that I'm going to attack and kill her?
Yes.
Do you ever feel bad for guys that they have to feel that?
Oh, no. I thought you were going to ask me what I do for safety. And that's
you
when
really
I take the key
centered
out.
that conversation around men. Well done. All right, I guess we're going to introduce our guest because Colin failed to give us any time to just catch up. That's great.
You could. How you been?
Oh, my God. Podcast canceled. I am done with this. This is just, I did miss this.
Damon's going to remix the whole thing. He can change the order of the conversation.
Perfect. Yeah. It'll make sense in post.
It'll just be 10 minutes of Eamon talking at the beginning, actually.
Where he's just promoting all his personal projects. I think he does have an Instagram. It's like New Haven Free Artists. I want to say NHV Free Artists. So check that out.
Nice.
But yeah, how you been? I know you've been scooping up houses.
Been trying, man.
I've been reading the New Haven Independent. I saw your name. You got to get an LLC, bro.
Did you?
Oh yeah, like they show you monthly.
I quick claim it right over to the LLC after purchase.
On the New Haven Independent, there's like the list of like monthly transactions where they like talk about stuff, and I saw your personal name right there a few
popped
times.
up heavily in the last one.
I know. Oh shit.
I know.
So you're a real estate developer now. Properly.
I'm a purchaser. Yeah, I'm an investor. Mm-hmm. Developer is a whole different ball game.
Okay.
But yeah, investor.
Okay.
Mm-hmm.
Nice.
Yeah, feels good.
Yeah, investing in the community.
For sure, I feel like I am. Yeah, it's a lot of work.
What does Kareem think?
We'll have to. Where's the comment section?
I won't weigh in on all that. I don't want to badmouth you in a public avenue based on someone else's jokes. So that's good. Yeah, nice. I did comedy for the first time in like 7 months this week.
Mm-hmm.
Still got it.
Yeah.
Yeah.
Just as it was before.
Yeah, just as however good it was previously. Which is okay. Yeah. Good. Felt good, man. So
that's
hopefully
awesome.
we can start doing some shows in New Haven again.
Was anybody in the crowd?
Yeah, there were a few people. I actually had some. Dave came.
Oh, nice.
Yeah, friend of the podcast.
Mm-hmm.
American Dave. And his fiance, Sarah.
I know. That's exciting news.
Yeah, they got engaged. A lot of COVID engagements and stuff.
She finally proposed.
That's right. Whereas I remain pitifully single.
Has that been weighing on you?
I mean, no more than any other year. Same.
Yeah.
It's just a plateau. I feel like it rose in my 20s, and at this point, it's just the same every year. It doesn't matter. So,
Is the plateau at your peak, or are you below your peak?
I would say below.
Okay.
There was a time in my 20s where I felt like so like rejected, and anyway, this is actually great, segue into our guest this week because we can talk about feelings. Our guest this week, don't call her Liz, Elizabeth Rathbun, clinical psychologist. Welcome.
Thank you.
Yeah.
It's nice to be here.
Yeah. So you are a therapist, clinical psychologist, just like my dad.
Am.
Well, he's retired, but yeah.
Yes.
You have a private practice?
I do. In
Okay.
New Haven.
Nice. In New Haven? Nice. Where at?
I'm on Bradley Street now, but I'm moving somewhere.
Okay.
I'm not sure where, but right now I'm all telehealth.
Just
so
do it out of like a dumpster or something?
wherever. Yeah.
Yeah. Great. Telehealth? That's what I was
Yes.
doing. I actually graduated from therapy recently.
did?
Yeah.
Congratulations.
After about 10 years.
Aw.
You've told me this like 4 times before.
Yeah, I've seen you like 4 times in the last 3 weeks. I don't have that many new stories. There's a global
not
pandemic.
about this graduation, about your previously
No,
being
I feel
graduated.
previously times I left therapy.
Yeah.
Yeah.
It's an open door. So you
Yeah.
can,
Yeah.
you know.
I left therapy on my own thoughts. This time my therapist was like, "Hey, if you want to stop coming, I would feel comfortable with that."
Oh,
Because
really?
you're just so mentally healthy. Maybe the mentally healthiest person I've ever met.
Wow.
Really?
These
do you
these
got?
are
You got
definitely
Donald
things
Trump's
that he said
therapist?
out. No, it's just I didn't have a lot to talk about. You know what I mean? I was feeling like I'm on a nice antidepressant. I feel, I mean, not great all the time. I have depression or whatever, but I have a pretty good handle on it. You know, so there's like not a lot to say. You know, I have my good days and my bad days, but it's like I think I have a pretty good grip on it, I guess.
Did you
So,
consider that maybe he got sick of listening to you?
either way, honestly, like I don't
doesn't
want
make
to
a
pay the
difference.
co-pays. Yeah, that's fine.
Yeah.
Congratulations.
Thank you. Yeah. But yeah, I mean, I was in therapy for 10 years. So you do CBT,
I do CBT.
which for the audience is cock and ball torture.
God.
Sorry, I've been waiting to make that joke all week.
Oh, yeah. No.
Like
That was
I've
clearly
thought about
pre-written.
It. Oh yeah, I've thought about it a few times. Like recently, I was like, don't forget the CBT joke, Josh. Cognitive behavioral therapy.
I do, but I do other things, and I think CBT is great, and it's also limited. So
Okay, what kinds of other therapy do you do?
acceptance commitment therapy.
What is that?
It is actually stems from kind of behavioral therapies, but it takes into account like mindfulness and being able to sit with conflicting feelings and allowing them to be there. And
So people
kind
can
of
have two feelings
diffusion.
at the same time?
yes, more than 2 even.
Yikes. That sounds
very
horrible. I have maybe, I would say 0.2 feelings per day.
I'm able to suppress almost all of my feelings.
That's right. Mine were eliminated by engineering school. They were replaced with math equations and algorithms.
That's funny.
Yeah, not true though. I do still have feelings. I do also suppress them. We are men,
We do.
so
We have to sometimes.
yeah, certainly. Yeah, to get on in society. I used to cry a lot as a kid, which if you are a boy in a middle school will not make you that popular. I don't know if you've ever tried to be popular in middle school, but as a man, but it is crying.
Am I not crying enough?
I
Why
tried
don't I have more
crying,
friends?
having outbursts, running out of the room. None of it worked. Writing suicide notes. Nothing seemed to work. Eventually, I found my fellow troubleds. And then we all started doing drugs. Worked out great.
Nice.
So,
Drugs bring people together. You got to admit that.
I mean, listen, it certainly got me some friends.
Yeah.
You found your crowd at that time, right?
Yeah. I mean, listen, when people are like, how do you make friends? I'm not saying that you should do drugs, but if you have weed on you, it will help.
Yeah. It'll
Like
make you friends.
Yeah, people will definitely smoke your joint. Like, people love that reefer. So, and if you're going to do a drug, I do feel like weed is probably the least damaging drug that you could do on a regular basis.
You can use all this in your practice, Elizabeth. This is
So
all
it's
in free
interesting you're
domain
talking
here.
about this because
Yeah,
this is
sorry
like,
I'm advocating for drug
no,
use.
no,
I'm not
no.
necessarily...
It's interesting because all these states are passing marijuana
Legalization.
recreationally, right?
Yep.
So Massachusetts did, so everyone just goes over there and gets it.
Yep.
Apparently New York is soon,
Yep,
and
New Jersey.
Colorado's been doing it for a long time,
Yep.
right? So I think Connecticut's there in some ways, but not in other ways because of the whole situation with brain development. And one of the things I think that they'd want to see is making the legal age of marijuana use 25, not 21,
Yeah.
because the brain isn't fully developed really until 25, and it can really affect
Yeah, I mean, I know
A
some
lot of-
37-year-olds who don't have developed brains, so
Well, it
what
really
can we do to
affects-
help them?
I don't know. I mean, you can regenerate to some degree, but
Right? Yeah.
some of that is like
So I actually
gone.
recently quit smoking weed.
Congratulations.
Thank
I
you.
think I saw that. Yeah.
Yeah, I'm AA
Big
sober now.
deal.
I quit in
Wow,
like
that is
December.
a big deal.
Yeah,
With
so
sponsor and everything?
no.
Oh.
I'm not like I did go to a meeting last night. I'm not AA is hard because they
It is
are
hard.
pretty into God,
Yeah.
but and I'm an atheist, so I do that stuff anyway.
Take what you can, right? Leave the
Yeah.
rest.
Yeah, that's what they say. So I don't know. I just more do it because it's nice to like meet other sober people.
Yes.
Because by and large, a lot of people drink, so it's just
Yes.
like weird to
Yes.
sometimes feel a bit isolated from community. But I'm really getting off track here. Anyway,
This
I
is
don't-
it, man. This is the track.
yeah, it's true. So I don't do drugs anymore, but I smoked weed for every day, most days for 25 years, and I went to a psychiatrist recently because I had so in November I turned 40.
Happy birthday.
Thank you.
Wait. Sorry.
That was a while ago.
Yeah.
There's a story coming. I wasn't soliciting a happy birthday, but thank you. Colin?
No. No.
So around my
I
40th
was there. I mean, it's
No, I know. So around my 40th birthday, I experienced a very low point of my depression and some suicidal ideation, and I realized that I needed to do something different. I typically have tried to go without drugs, like antidepressants, and I've definitely been one of those people who tried to if I just take care of myself, I'll be okay. But I hit a point where I was like, I can't keep doing this anymore, and so I went to a new psychiatrist who's recommended by my therapist. And they basically were like, we'll treat you, but like we typically don't like people to be doing drugs while we treat them, And so I was like, all right, well, I've been smoking weed every day for 25 years and it hasn't really made me happy, so maybe I'll give it a whirl. So now I'm on Cymbalta, which 2 thumbs up from me. Nice 60 milligrams, pretty great.
Nice. Low side effects, right?
Yeah, low side, right. So I used to take Lexapro, which has sexual side effects for me at least. I mean, I will say I was so bummed out in November. I would have gladly taken sexual side effect. Like, I don't, sex is great, but I could have left it if that's what it meant. But yeah, so I haven't really smoked weed since then. And it actually, it hasn't been that bad. Like, I don't know. I was definitely doing it more out of routine and habit than any sort of happiness I get out of it. So
Elizabeth, do you think it's not good to legalize weed? Are you anti, or are you just for
on
the
the fence.
risks?
I don't think it's great for people to be doing it consistently and chronically at young ages, because I really do think it affects a lot of things, motivation, certain brain development, and
yeah, it's better to develop a drug problem around age 30 if you're gonna just do drugs every day.
but
You have
I
so much
think
more money then. I mean, it's just
Yeah,
easier.
exactly. It's just you have the buying power.
You don't have to spend your lunch money on drugs. I mean,
Exactly.
it's no
You can
fun.
get lunch
So
and
hungry.
heroin. Like, that's nice.
Yeah.
You don't have to choose.
Exactly.
right. So wait until the full-time job. No, I think that I just think there's different takes on drugs now, and I think that's a good thing, because I think we're opening up this idea that it's not necessarily like, and I'm not saying drugs don't have bad effects and negative effects, but I think the reality is people are going to do them, and in some ways, does it regulate it more to have it be allowed recreationally, marijuana? I don't think people should be going to jail for selling marijuana. I just don't.
Yeah. What if they just said no to drugs? Wouldn't that work?
That would be great.
I do agree with that take. I mean, I think the getting people wrapped up in criminal justice for weed is totally wrong. We don't need to be doing that. But yeah, I'm concerned as someone who smoked weed all the time in high school that it's the idea that you don't want to give out the message that marijuana is no big deal. It's ridiculous that it's illegal. It's like that's a little further than you want to go. Obviously, you don't want to get people arrested for it, but it's also not it's not no big deal.
Right.
Yeah, I think the issue is that prohibition is not really an effective policy for drug use. It hasn't really worked. Like, people still do heroin. It's illegal. Like, addiction is sort of a separate problem from prohibition. Like, my father worked in addiction for 35 years, and he basically thinks all drugs should be legal. Like, he just like he thinks that the criminal justice system really has nothing to do with it. It's like a public health issue, and that like making these hard drugs even illegal doesn't really matter, because like if you're gonna get addicted, you're gonna go down that path no matter what. Like if you get, like, I've had plenty of friends who, they had injuries, then they started taking pain pills, then they got hooked on like OxyContin. Once they ran out of money for OxyContin, they got addicted to heroin. Like, and when you're that deep into an addiction, you're gonna go get heroin. Like, the law has nothing to do with it at that point. Like, you are so into that, like you're either gonna recover or not. But like, whether it's against the law isn't going to like move the needle. I feel like it's not. It's just like, I don't know. I don't think getting the cops involved helps in one way or the other.
So do you think sports and sports injuries are the real gateway to heroin use?
I mean, I'm just saying that there are paths to drug use that are not as obvious. You know what I mean? That are like, like there are people who didn't go in thinking. I mean, I had a friend died of a heroin overdose, and he was just an alcoholic. Like he just, his alcohol problem was so insane that every once in a while he would just do hard drugs with like his friends, and one time he just did too much. Or got a bad dose. I don't know what happened, but
Yeah, I think there's so many factors, right? I mean, there's never just one factor, but I think there's a lot of influences and a lot of things impact us. So, and I think that's also very individual.
Yeah. I mean, for me, like, I'm like, I realize now that, doing drugs all the time is really just a way to numb myself or to avoid trying to experience myself for fear that there's something terribly wrong with me or whatever.
Yes, and sometimes that can be a survival mechanism to a point, right? I'm not saying that we should turn to that necessarily, but in some ways it's a mask, like a lot of different things that we do, right?
Yeah, and it's like, I think it's important not to like judge yourself too harshly.
Absolutely.
Even if it's not the optimal coping mechanism, that like, you're just a person. Like, you're going to make some mistakes. It's okay. Yes. I try to tell people that. I'm like, like, I have a friend who's like, oh, how are you like being sober right now? I'm just drinking too much. I'm like, hey, you're like 28. Like, you're going to fuck up. Like, that's, I mean, even if you're not, like, it's okay. Like, we're all fucking up all the time. I mean, like, trust me, I ate a box of Sweet Tarts last night. We're not perfect, I'm better than you because I don't drink, but,
Wrong with Sweet Tarts.
Is a box a lot? It doesn't sound like that many.
It's just a silly amount of sugar to consume by yourself.
All food's fat. I work with eating disorders, right?
Okay, do you?
Me too.
Nice, yeah. I have a pretty weird relationship with food myself. But anyway, we really got off track. So acceptance, commitment, therapy?
Yes.
Wow,
yes.
I can't believe I remembered that many minutes
good.
later.
Yeah.
Stop smoking weed.
I know. I have super memory.
Yes, I do that, and a little bit of some work around, of course, family work.
Eating disorders.
Eating disorders, and also just kind of, overall supportive therapy, and looking at all the different parts of us, I don't know, I think it's complicated, and I think it depends on each person.
Mm-hmm.
Is there anything you won't do if someone comes in and spills their guts? Would you ever be like, nah, I'm not into that?
Oh, you mean like a specific area?
Yeah.
I mean, I think I really try not to go out of my scope. So if somebody comes in and they have, like, for example, like really serious OCD, then that's not my scope. And I would send them to someone who's a behaviorist who does
specializes
exposure,
in that sort of thing.
Yeah. Exposure, ERP, it's called, therapy. So, so something like that. Or, if they're not able to be contained or safe
nice. Good job.
Or not, very, very smooth.
Guess they just don't like to talk into that mic. No. They like to wander around. I don't know what it is.
It looks like a shower cap.
It's a discipline.
It does. That's a COVID thing. It's not normal.
Yeah, no, I get it. I get it. It's kind of cute, but
do you ever just personally not like someone who comes in for therapy?
Yeah.
Oh my God.
You said it like
great question.
No, it's a great question. Everyone always asks that question.
Everybody asks that question? Wow.
Well, a lot of people ask that question.
Yeah.
I think it's a good question.
What percentage would you say?
Oh gosh, that of people I don't like that.
Yeah.
Oh, like 1% or less.
Oh, okay.
I really love my clients.
I thought you were going to say
lucky.
like 30%.
Me too.
No,
Your initial reaction was like, whoa, most.
Yeah.
Okay.
No.
So it's really just Jim. I get it. Yeah, he's a dick, no doubt. One thing I did want to talk about is one of the things I definitely try to tell everybody to go to therapy. I think almost everybody can get something out of it.
Great.
But I think one of the people struggle with is finding a therapist and the process of finding a therapist, because, there's obviously the insurance complications, and it's like just throwing darts at a dartboard. Like, how do you find somebody who fits? Like,
This is such a great question. I think pre-COVID, you could doctor shop.
mm-hmm.
I think now it's so much harder because therapists are full, and it's harder to kind of find somebody and even just someone to call you back. But I really recommend talking to a therapist before you fully commit to them. If you feel like, it's not like a right away fit, like going to a couple sessions or getting to know them or asking them questions. I know it can be really intimidating, but I think it's really important because there really are. It really is a fit thing, like a goodness of fit. And so I think a lot of times that can happen. And some people will just stick with that person because it's the only person, or they don't know they can change or say, hey, this isn't working.
They just want to go through that process again.
Yes, understandable. And it is an awful process. It's really messy and it's really unfortunate. And, I think some of that is the insurance piece, is that they don't necessarily make it easy. They have people on the panel who are dead.
Yeah.
Or
not taking new patients. Yeah, huge problem.
So I think that's really hard. And I also think right now, especially, there is a shortage of therapists, especially around
a lot of
New
people
Haven.
have been going in. Yeah. It's, and it is such a relationship thing. Like,
Yes.
you really, like, to get the most out of it, you need to be able to trust this person. Like, I talked about things in therapy that I probably have never told any other human in the world. You know what I mean? And that starts with, like, building that relationship over time and be like, this person is going to, is looking out for me and is going to,
tell you what you want to hear. That's important. You want someone who's going to tell you what you want to hear.
That was not my experience.
You haven't been to therapy, have you?
No,
No,
I haven't.
I would recommend.
Yeah. No, that is, this is not whatever
no.
therapy show you see. I should have got, who are the other? Sean and Shane, I think, have also not been to therapy, so this was a bit of a lost cause. None of the co-hosts with, that's all right. So, it's very relationship based, though. I think hard.
It is. And I think, like what you said, it's like such an intimacy. It's like such an, unique intimacy because it's one-sided, right? But it's things that you don't necessarily tell another person. So it's kind of.
And it takes time to learn how to, I've been in therapy a long time. So when I went to, for instance, see a new psychiatrist to get medicated, I kind of knew, I knew how to describe my mental health. I knew my history. I knew how to, approach it in a very reasonable way and kind of give him all the information he needed quickly. But that takes time to be like, yes, I know that this probably started when I was a kid, and here's the traumas I experienced that I feel like led to the way I feel about myself, and all these things. So
yes,
but that just takes a lot of time.
It does. It takes a lot of time, a lot of vulnerability,
trust. Yeah.
Yes.
Oh yeah, I cried a lot in therapy. That's fun.
As much as middle school?
Probably not. No, at least more in control crying, I would say, at least less just straight up bawling. Also, a therapist is just not as mean as a middle school kid typically. So,
it's corrective crying, right?
I guess, yeah. It's, I mean, for me, I talk about my mom sometimes. So that's often, it's a bit of a sore subject. Mother's Day is coming up. Isn't that nice?
Tomorrow.
Yeah. You want to hear about a fun conversation I had with Alexa? So I was like, hey, Alexa, turn on the light. And she's like, did you know that I can also provide ideas for Mother's Day gifts?
Damn, Alexa, you're supposed to be smarter than that.
I was like, Alexa, my mom's dead. And she's like, no problem.
Oh, no.
I laughed. I had a good laugh at that.
Yeah.
I was like, it's pretty funny. But you got to have a sense of humor about the darkness of life. I mean, I do. Not everybody does. So, it is so hard to find a therapist, especially now. Telehealth obviously is not the same level of intimacy, So
yeah, I think that's interesting. All the people I see now, I've been seeing for a long time. I don't have any new people pre-COVID.
I wonder if that's why I graduated from therapy. He's just like, I got to get some new patients. And you got to get the fuck out of here, bro. There are people who need real help.
I'm just saying, consider that option.
It's fine. I forget what I was going to ask. No, I give up. It's fine.
So people that you don't like, what's the reason you wouldn't like a patient?
That's a good question. I think it's my own shit, right? Like they're bringing up something that bothers me, and
you're a human.
I haven't fully worked through, and so I mean, I have people.
We all have pet peeves.
I have a therapist, and I have
that's good.
friends that are therapists. So I do peer consultation, and so it's something that I like to talk about. And
You don't go to like
sure
a therapist who's a friend of yours, though, right?
No.
Yeah.
No.
Oh, I know what I was talking about. So I was dating a therapist over the summer.
Mm-hmm.
It's not you. Just to
No,
be clear
I
to
know.
the audience. I know you know. It would be funny if she's like, wait, what? We were dating?
Did you think we were dating? I texted you one time, Josh.
Eamon missed us for sure.
Oh, yeah.
I don't think the midwives party like this. I was dating a therapist, but she was like a transpersonal therapist, which I don't know. She was into like ketamine therapy, and she was into like very spiritual focused. And she was always number one trying to get me to do ketamine, which I found pretty off-putting. But also just like she was just a very spiritual therapist. She was about sort of like this idea of collective unconscious and like, and I feel like for me, if I'd gone to someone like that, it would have been a really bad fit.
Yes.
But for some people, it'd be a great fit. And so it is really important to understand that like there are a lot of different types of therapy out there.
Yes, I think that's a good point. And I think there's a lot of confusion around that because sometimes coaching, which is like kind of the new...
Oh, like life coaching?
Yeah, is like similar to therapy. And I feel
but
like
it's from
sometimes...
some lady who didn't finish high school. Yeah, I get it.
Well, and I'm not saying your friend was. It sounds like she was a therapist.
Yeah,
She sounds like a drug dealer to me.
Well, actually, her partner, who's a psychiatrist, is technically the drug dealer in this situation. She's more of a drug pusher, I guess.
Yeah.
Let me tell you, it did not end well. So if she listens to this, I'm going to get a pretty angry text.
Do you think she was recommending ketamine to every patient she had?
Oh, yeah. Yeah.
Really?
She was a ketamine-based
that's kinda like-
therapist. Yeah.
That feels... I don't know.
She kind of is a drug dealer.
But to her mind, it's about like in her brain, the way this all goes, she basically is trying to like penetrate deeply into your trauma and for you to have an almost religious experience, like getting down to some core level of your like being, I guess.
But there was just one solution, no matter what your problem was. Everyone that came in.
I think maybe mushrooms could have been the solution too. I don't know. Yeah, but I mean, people sought her out as a ketamine therapist and like basically as an alternative to maybe traditional therapy. So I feel like most of her, and also she was like New York based, so like a lot of her clientele were like
part of the rave scene and that type of thing.
I would say more like how people from New York are.
You could go in a lot of directions. I don't know.
I think that she works with a lot of artists, maybe, actors, like, or business people who were sort of looking for something a little bit different, and were willing to, I don't know. So it was pretty fascinating.
That's interesting.
But I was like...
artists, business people, those types.
Yeah.
Well, just people with money. Number one. Or parents' money. I don't know.
It's a thing now, though.
No,
I mean, they're doing
a-
studies at
yeah.
Yale. It's really done
Yeah.
a lot for depression and anxiety and PTSD.
But she was like always trying to tell me, and I was like, all right, I'll research it.
Yeah.
And basically what I read was essentially like, it's a good idea if other stuff doesn't work
right.
first.
It's a kind of a last resort.
Right, exactly. Like, for treatment-resistant
Yes,
depression.
exactly.
But I have treatment-good depression.
Yeah. Receptive.
Okay.
She gave me the most disappointed look when I said that.
Did you say that? Did you laugh?
No. But she just, yeah.
Well, I
So.
wonder if she's got some sick thing about watching people on ketamine.
Probably, yeah.
And like that kind of drives her wanting to have everyone take it.
Yeah. Well, I think we had this really interesting conversation
Elizabeth,
about...
what do you
like,
think? Let's dive deeper
I
into
don't know
Josh's
this person.
ex-girlfriend.
I know, right?
Yeah.
Like, let's analyze.
Oh, that's why it's the
another
best. Yeah,
therapist.
she's not here.
Yeah.
You don't know her.
That's really
you can say
ethical to
anything.
to do that.
She's not even like a top 5 ex either. Like, we could have
really.
a fucking field
No.
day here.
It's just afterthought. Yeah, it's fine. No, Josh is probably still in love with her.
No.
Yeah,
But
no.
anyway,
Okay.
I found it a little bit aggravating, but nonetheless, I'm a very like I'm an engineer. I think very like sort of scientifically about. I try to anyway, and
Like analytically.
yeah, exactly. So like that's how I'm like, yeah, I will take the thing that works for the most amount of people that has the most amount of research that we understand the best. So, yeah. So I don't know. What do you? I had a friend, and I don't think he listens to this podcast, but if he does, I apologize. I'm not going to use his name or anything. But he basically, I was trying to get him to go to therapy because I know he has some issues with like insecurity and stuff. And he's like, well, I'm going to go to church, and that's basically the same thing. And I was like, well, I don't. Like, what do you say to somebody like that who's like I understand, like, I'm not a religious person, but I understand that there are support systems in the world that can help lift people up, that spirituality is something that some humans get something out of. I don't personally, but
if you go talk to a priest or your religious person, isn't that the same as a therapist in a lot of ways? If they're actually giving you,
but they're not
good advice that's helping your life.
Well, I feel like the problem is that they're not really like delving into the core issues. They're basically saying, well, it's part of God's plan, or it's all, it goes back to God. It's not like you're not going to like deal with your personal traumas, like you're not going to like one of the big things that I got out of therapy, or sorry, you want to say something?
No. It's okay. Ask a question and then give the answer. No, just kidding. That's not funny.
Wow. Go on.
I kind of did that. No. That was really
please.
No, I just wanted to say quickly, that
you just got put in your damn place, man.
As I should. Yeah, 100%. I
think you should probably just shut your mouth for the rest of the podcast.
No, I was just.
If you hate hearing me talk, tune in about half hour in. All right, go on.
Sorry, John.
Elizabeth is not going to tell you what you want to hear. You should start going to her.
She's right. She's 100% right. I was interrupting.
So, okay. Yeah. So here's the thing. I kind of agree. Like, people need to find peace however they can find it, right? And I do think some people can find that through their church or religious service or support, whatever. And I also think that can be really complicated and dicey, because if your specific religion or spirituality, has a way of like shaming certain things, I think that can be really complicated, right? And so, like, for example, if you are making a choice about a huge life decision and your religion kind of doesn't support that, but you know what you need, that can get really tricky, right? And it's like, is this what I need, or is this what the church or God thinks I need, right? So I think in some ways going to therapy outside of church can be really helpful, because I think it tends to be more objective. Not that we don't have our own biases, right? But I think it tends to be more objective, if that makes sense.
Are there like therapists who maybe are, I don't want to say like church friendly, but maybe
pastoral counseling? Yes.
No, all right.
Yeah,
I think exists.
like
Christian counseling
and like marriage and family counseling has been a huge part of the Catholic Church for years and years. Like, tons of people go for marriage and family counseling.
And what sort of like,
and a lot of that is lay people there that are trained and do therapy.
Yes.
So
okay,
there's a huge network all around that.
What is the educational like background of these people? Like, are they?
Well, I mean, priests and pastors do often take some counseling classes. I mean, some of them do have that training. I think they have to, on some level, have that training. And then some people will be like church representatives who like are in the church, like a couple or something, and they take specific training. I don't know if they're necessarily trained therapists, like licensed, but like I remember people doing it for pre-Cana. Like, they have to do this if you get married in a Catholic church. You have to go to like this retreat with it's like Catholic counseling, to kind of talk about your relationship and your future and your goals together, right? Like, but around this frame of like being a Catholic and getting married and what that means. You're not. I don't think you're necessarily diving
because
I don't know a lot about it. I mean, I don't go to church.
No, I just mean in general. I'm not going to weigh in for the rest of this podcast. So like, you got to do some fucking heavy lifting.
A baby.
Yeah. Well, I was the first child, so I mean, I need the attention. Yeah. No, that's cool. All right, fair. I guess I didn't really think of that in terms of like the counseling, because like I know one of the big things I got out of therapy was basically realizing that like both of my parents basically didn't really show much warmth or affection, essentially because they both grew up in really like traumatic, abusive households, right? So they didn't know how to show warmth or affection. It's not that like they disliked us. It's just they literally were like too broken in their own home situations, right? And how much that reflected on how I felt about myself and my own worthiness of love or all this other stuff, right? And that was something I had to figure out through talking about, my parents, the way I felt about myself and all this stuff. And like my feeling is you're not necessarily that depth of understanding is going to be hard to find at church. You know what I mean? Like that's something that takes a long time. Now that maybe the counseling could uncover something like that. I don't know the depth of it, but I know for me, that's been like extremely fundamental to my growth as a person, to realize that like a lot of how I feel about myself is connected to stuff that like is just like stuff that just happened to me, and it's not really reflective of my worth. It's not anything I did. It's just like generational trauma. Like nobody did anything wrong. I mean, my grandpa did, but
Yes.
Everybody's grandpa did something wrong.
Yeah.
My grandpa did a bunch of stuff wrong. You want me to list them?
I think it's like just going back to the church thing. It's less like, I don't think you can weigh in like, oh, church, that's not the place for therapy. I think even if it's therapy, it just depends on, are you going to a therapist that's good? Are you, if you have a trusted aunt, if you have a trusted person at church, a trusted therapist, whoever it is, if this person is giving you good advice that works for you and they're really listening and understanding, I don't think it particularly makes a difference if they, not to knock therapists or anything, their training level or something. If someone's good advice is good advice, but
good advice and therapy are not the same thing though. Right?
No, it's not the same thing, but it doesn't have to be deeper than good advice. If this is a person that you really trust, that you can open up to, and they can really listen and give you feedback, I don't think it particularly matters if it's, if the person has had specific training in, doing therapy, or they're a psychiatrist or psychologist, or that's certainly beneficial. I think it's just a way of, you can't really knock the whole church because it's not a psychologist,
Yeah, I hear you, because I think it could be beneficial. I agree with you. I think there's, pluses and minuses of anything. But I think if somebody is comfortable with that and that works for them, great. I agree with you. I think I've seen it, though, not be helpful for some people. Because it's hard. Yeah. The lack of objectivity can be really difficult, especially if someone's like, if they're already feeling shame, and then to feel shame for just whatever, a decision they're making or not making.
Yeah, right. There's obviously some choices or some lifestyles that are just simply not going to be compatible with the church.
Yes.
Like if you just, if you're like a transgender person, like there's just almost no way that situation is going to like end well.
For sure.
So
yes.
It really depends on the person.
Yes.
So, all right.
Elizabeth, have you ever graduated a patient?
Yes.
So that's a real thing. That's
like
a real
thing.
Okay.
Yeah. Yeah.
Okay.
It's interesting.
And it's not just because you didn't want to talk to the person anymore.
No. I mean, I have, said to people like, I'm not sure I'm helping you. I want to make sure I'm helping you, and kind of checked in about that, or,
Like if the person is one of those 1%ers, like
no, just like if we end up not being a great fit, or they're just not getting better, or
do you
something.
find that people sometimes are not putting in like the work that like?
Yeah, I mean, sometimes, and sometimes I think they're trying. They're just not able to get out of their own way, just on some level. And I think sometimes we're just not ready. I think sometimes we're stuck. And that's where we need to be for whatever reasons or whatever's going on. And that's why you said something about going back and forth to therapy. That's why I think it can be really helpful to take a therapy break and then come back, or, kind of check in and leave the door open, because I don't know if it's ever done, right? The work. I think it's done enough to like, okay, I don't want to keep going to therapy for the rest of my life, but I think there's always work to do, right? Does that make sense?
Yeah, no, 100%. So let's talk about resenting my father in particular. All right. I don't think he listens to this podcast, so we can probably... So
is this the part where it just turns into a straight therapy
session?
session?
No. Elizabeth interviewed for a job with my dad.
Dad.
Oh, really?
My pre-doc internship. Yeah.
But I don't think she got the job. So let's talk about how much my dad sucks.
No. It was. I don't think I picked them, and I don't think they picked me.
You know, he will never accept any of us. He's not proud of you or me. It's just the nature of it. He's not proud of my sister or my brother. It's fine. Like, we just got to stop trying to earn his love.
You and your dad were close.
Well,
no, we're pretty close. Yeah. We get along pretty well. But he's funny. Like, my dad, like, I posted this question on Facebook and I got like a bunch of joke answers, and I was like, I would appreciate more real answers. And my dad's like, well, if you weren't a comedian, this wouldn't happen. And I was like, thanks, Dad. Just classic, come in, quickly blame me for it all, and then get the fuck out. Like, he's just like, that's his move. So he's a pretty funny guy. But what happened there?
you're asking for too much, clown.
What happened?
Because you met him, right?
Yeah. Oh, yeah. So what happened is it was a pre-internship thing. So it's like a match process. So you rate your first, whatever, 5.
So you gave him a failing grade?
No, I mean, and they also rate us. So they probably didn't rate me, and I don't think I rated them in the top 5. I don't remember.
Whoa. All right. I'll tell my dad what you thought of him. Yeah. And it was because my dad worked for the state for many years.
it was a pretty good.
Demas.
Well, there was a lot going on there. It wasn't your dad, but there was a lot of other stuff.
Oh yeah,
that,
I mean, working for the state is like a whole. Yeah,
there's some good stuff happening.
Yeah, he wants. Yeah,
it
is definitely like funny how much. Yeah, between the fact that like you're basically working with addiction and the fact that you're working for like a bureaucratic mess, there is a lot of like lack of progress being made. Yeah. So it happens. So what's going on over there?
I don't know. My headphones cut out.
Oh, yeah, it happens.
I'm just gonna wing it.
Yeah, that's fine. Okay. I can hear you.
I feel naked.
You're doing great.
Wow.
Cool. So therapy, mostly good. We love it. It's great. Go to therapy.
Go to therapy. Yes.
Nice. Are you on any drugs?
On any drugs in terms of what?
Antidepressants or recreational? Are you on ketamine right now?
I'm not on ketamine
currently,
but I have a nice cocktail.
Oh, nice. You don't have to talk about it.
I don't mind.
Kidding. Yeah.
I think it's important. I think it's, I think in this day and age, I really respect people that don't need that. But for me, it works best and I function best. And I kind of used to be in that pool of like, oh, I don't need this. I'm fine. I can, I can tough this out.
Yeah.
And then I'm like, why suffer? Like life is shitty.
Yeah.
And not easy. And so, let's like make it a little easier for ourselves. And so I feel like when I'm on really works for me.
Yeah. It is like I had an ex-girlfriend and she was depressed, but she didn't know that she was depressed. She just thought the world was horrible, which like obviously it is. But like when you're not as depressed, you're a little bit more able to cope with it.
Right.
How do you approach people who don't know that they're depressed or they don't know that they have a thing?
Well, I mean, I think most people know that something's off if they're coming in the door, right?
Or but if they're not,
he's talking about on the street though. Like how
do
you walk up to someone on the street and then start telling them what's wrong with them? Like how do you do it?
I would say maybe
that's the next segment. So we're just kind of want to know.
Yeah, that's right. We're leading into the next segment. Tell strangers what's wrong with them. What's the theme song for that, Abe?
It's a tough one.
You're about to have a bad day.
It's Clyde's song. All right.
So basically, how do you
approach friends who you feel would get some help, but like are really either resistant or
do
they don't
you
even
not
know
because they're just trying to come out to the bar with you and have a good night?
Yeah, and just kind of forget about everything. Yeah, it's a tough one. I mean, I do think.
How many crying episodes do I have to watch before I'm allowed to offer an opinion, Colin? How much time do I have to spend watching somebody sob quietly in a bar before I'm allowed to? Weigh in.
I know.
Thanks.
It's hard, right? Because you've watched people suffer and you don't. It's a hard thing to watch, right?
Yeah. I want people to be happy. Not Colin, but most people.
I've never gently sobbed in a bar before.
No, we know. You don't have feelings. We get it.
So I think it's, obviously talking to them in a way that's like, out of concern and saying that I've noticed maybe you seem something's off or it seems like you've been really sad or I'm worried about you, I care about you. I mean, I think sometimes just saying those things and asking them, letting them know that you're there, and kind of opening that up without putting pressure on them.
Mm-hmm.
Obviously, if they're in more of a dire situation and they're unsafe, then you want to get emergency help. But, if somebody's struggling, I think it's important to offer them your support and like an openness and just let them know you're concerned about them. Right. I mean, I really do, because I think the reality is that ultimately when we struggle, it's really hard to be alone in that. Even if we're alone in the suffering, right? I think there's something to connection that can help sometimes bridge that, or at least, just knowing that someone else is there for you, even if they're not getting it, is powerful, right?
Yeah, no, that's why I'm very open about my depression. I want to share my suffering with others so
you can absorb it.
Yeah, exactly. They're going to share my burden because I refuse to go alone.
Do you feel like people seek you out, like your friends, people you know, because they know you're a therapist for...
Sometimes,
like
yeah.
And you're just like, I just wanted to come out to the bar, guys, and hang out. Please stop sobbing. This can't happen anymore.
I feel the same, but it's for websites.
Totally.
Sometimes, but a lot of my friends are therapists, so I think that's
Right.
interesting. But yes, people will ask for a lot of advice, or like a therapist in a certain area, or
Can you look at this mole I have on my back?
I'm not that kind of doctor.
Nice.
Yeah. So yes, they do sometimes, but I don't mind, because like you said, somebody else's, I don't know, some other specialty, and I'll ask them. I just think that's what people do.
Do you ever feel like your friends feel burdened by the weight of your judgment when you're talking to them?
I feel burdened right now.
Yes, they do. No, I don't know. I'm sure. I mean, I can be judgy. It's hard. You know what it is? Sometimes it's hard to watch a train wreck and not get too involved. And so I think I've learned to step back more.
Because, and just watch the train crash?
Yeah. Or try to stop it and like do all you can and know your boundaries and
yeah, that's healthy to
care
just
of yourself.
Call it quits at some point.
Yeah.
Depending on what it is. But, it's a tough one.
It is, yeah. I was talking with my friend who struggled with alcohol and addiction. Like at some point, I tried so hard to help him, but it's like he burned so many bridges that I just like had to keep him at arm's length. Like there was just no way. Like I knew he would steal from me. Like there was just nothing he could do to help himself. So that's just like, it's too bad.
Mm-hmm.
So
it is.
All right, let's play a game.
You're about to have a bad day.
Like, if we had the technology, it's not that terrible of an idea. Like, no, it is a very terrible idea, but that's what makes it a good idea.
We'd all run up in a pack. All right, Elizabeth, go. What's this guy's problem?
She could be a regular, recurring, like,
That'd be great.
Street personality.
I'd
Billy
love
on
to
the
be.
street.
Do you ever get questions?
Elizabeth on the street.
I would do that if you ever have questions or something.
Yeah, I would actually. I have a friend who's doing a podcast. Listen, if you have questions for the podcast, please email me, josh@betweentworocks.com. I would love to answer questions on the air. Anything you got.
Yeah.
Yeah.
Got to fill this time.
Yeah, we got it.
Well, you know what I mean? If you have mental health stuff that comes up, or like people, I know that gets to be like an advice game, so that's weird.
Yeah. So you want to start a separate advice column podcast? Is that what you're saying?
No.
All right, cool.
It kind of sounds like that's what you're saying.
No, I'm just saying I'm available.
I'm
not
dating?
starting it.
Feels a little bit like we are. Great. So let's play a game.
Okay.
We like to play Fuck, Marry, Kill, but instead of with people, we do with ideas. I was thinking either we could do like therapy types, or we could do even like I don't know, mental health something or other. Like, what would be...
You thought deep about this, huh?
I think deeply about all things. Well, at first I was thinking therapy types, and I'm like, that might be too specific. It might be too niche.
Yeah.
And I was almost thinking like, I don't even know. Ways of dealing with mental health issues.
Okay.
Maybe.
Drugs.
Drugs, yeah. Fuck drugs. Marry therapy.
So that's it? That was your idea?
Oh, before we do this, actually, quick pause on the games. Meditation. Do you do it? Do you recommend it?
I do it.
Nah,
do
I
do it?
didn't believe that.
No,
Do you
I
really?
do. I really do. I really do. I try to do it every day.
Oh,
I don't
even
do
better
it for
question.
that long. Yeah.
This is related. Are there things people can do like meditation if they don't have insurance, if they don't have
That's a good question.
options?
Yes.
What is something that maybe they could do that would help them deal with their mental health struggles if they don't have money,
Yes.
if they don't have insurance?
Yes.
No time, no motivation, no money.
No interest in
Yes.
working on themselves.
Yes.
No, I'm just
What's
kidding.
good for them?
Yeah, no. But seriously, if
So-
money is an issue,
Yes.
or
So 211 has a lot of mental health resources.
okay.
So does Connecticut Psychological Association. And actually, we have a mental health
She
awareness.
said that in a weirdly sassy
Yeah,
No,
that
I'm
was
way.
like
on the board. I'm on the board. I got to
She
Come
literally-
check us out, huh?
She like shimmied.
Yeah. Definitely.
What was the organization?
Connecticut Psychological Association. So
Okay.
it's the Connecticut
Psychological
Guild,
Association.
right?
Yeah.
For psychologists.
What
we're-
if we say it one more time?
What did you say? What?
Say it one more time. No, I'm just kidding.
Yeah,
Go
okay.
on.
So it's conpsych.org, and we have a lot of resources there too.
Okay.
And we have a mental health because it's Mental Health Awareness Month.
Yep, it's May. Yep.
Yes.
So I think I failed to
Wednesday
bring it up.
evening. You think you failed it?
To bring it up until
yes.
this now for
Yes.
some reason.
Is that why you picked me to come?
Well, you messaged me directly, which helps.
did.
Yeah.
I didn't want to,
So.
What would
feel
you,
like
is there
pressure.
something you would recommend yourself? You're
Oh,
pointing
yeah.
out a lot
So
of
I was-
places for people to go
I
that they
am-
will not go
No,
to.
but there's there's an event. I think it's important to understand about mental health. It's Wednesday night. But yes, there's actually, I think grounding skills are really powerful, and anyone can do them anytime. And so they're very basic. But what I like about them is they can help people with trauma. They can help people with depression, anxiety, and it's so there's different kinds of grounding. If you think about grounding, it's like you think about a tree rooted in the earth, that's grounded. So if you feel overwhelmed or something like that, even you feel an urge to use or do something that's harmful. Grounding can be really helpful because it can help you stay in the present, but kind of get outside of that emotion a little bit, have a little distance from it. So it's name 5 things you see that are yellow, 4 things you hear, 3 things that are blue, 2 things you smell.
I saw this on
It's
a
kind of
episode of
sensory.
BoJack as a way of dealing with a panic attack.
Yeah, that can help with panic too.
I think it was 5 things you hear, 4 things you see, 3 things you can smell. It was something like that.
Yes.
Yeah, just getting out of your own head, basically.
Yes.
Anything you can do that would actually
Yeah, and it can be calming and grounding, and you can also do it numbers, count backwards from 100 by 7, which is hard.
by 7. Wow.
Something like that.
Yeah,
What
you
if you
guys
start
are-
grounding all the time throughout the day? Is that a problem in itself?
It might be a little tricky to,
Just become a monk. You're
Yeah.
fine. Just go all in, become a monk. There's no need to be a regular human. I did a lot of grounding
water,
in middle
too.
school because I didn't do my
Drinking water?
Water. Well, there's something called
Water
the
torture?
dive
What are you doing with it?
response.
Yeah, waterboarding?
No,
What
no,
are we
no,
talking about
no,
here?
No. There's something called the dive response, which is cold water. So we see mammals do this all the time. It's a physiological response.
Colin's a mammal. If you've ever seen him without a shirt on, you would know.
Extremely mammal.
So this will work for you. So putting cold water on your face, chewing ice, taking a cold shower, anything like that can reset your nervous system.
Chewing ice, I thought it was bad. Everybody always tells me not to do it. I love it.
See?
It's great. And I'm so healthy.
I
that
thought it means
graduated
you're
therapy.
sexually frustrated.
Yeah, that's what everybody always told me, but I had sex
Well,
last month, so
that's
I don't see
science.
how that could be true.
That's science.
That's science.
It is science. It's
All right,
true.
so fuck, marry, kill. We haven't figured anything out yet in terms of what to do it about. Do you have any ideas,
I
Elizabeth?
mean, I just can think of therapy ideas, but
There's 2
Yeah,
people on the
therapy
street.
ideas
Let's
are
attack
great.
them.
Yeah.
what do you usually do? I'm
Well,
not.
it depends on the subject. So, if
Yeah.
it's about pizza, we would do it about pizza places. If it's about
I like that.
games,
I
you
mean,
would
I
do
eat
it-
pizza.
I know, but we do pizza all the time.
Okay.
Well, we could actually let's do restaurants in New Haven. We haven't done that in a while, It could be
Yes.
fun. And we're always eating food. And
Yeah.
if it's not pizza specific, I'm fine with that. All right, yeah, fuck, marry, kill restaurants in New Haven.
Okay.
Hell yeah. I would fuck Rawa just because I don't think anybody goes there that much. And their hummus is so good.
Okay.
Also, I brought 2 dates in a week there. And like their waitress gave me like a knowing look, and I appreciated that. You know, I love when I feel like I'm on like an in joke with them, and they're like not blowing my cover. I like that. It's fun. It's a cool spot. It's not that crowded if you're like feeling a bit COVID. You know, not fear, but you know, I like it. They got good Mediterranean food, weird pizzas.
So is that your first date spot?
Well, yeah, now I never used to do food on first dates. But now that I don't drink, I find it's not a big deal to commit to dinner because...
How come no food? Do you think it's uncomfortable eating in front of another
people
person?
Kind of do drinks or coffee on first date just in case it's really bad. So it's you know, not that long.
Yeah.
But since I do comedy, I'm willing to suffer if it's funny. So.
Yeah. I went to a restaurant one time on a first date, and they were like, "Oh, we don't serve alcohol, but you can. It is BYOB. You can go get some." And we looked at each other and we're like, "Yeah, let's go get a 6-pack right now."
Yeah.
We can't stay here. Yeah.
Yeah, alcohol definitely helps, you know, loosen the inhibitions. But I do comedy, so I'm used to like just flying into the wind, trying to impress a stranger. So it's fine. Yeah, Rawa will be my fuck.
Okay.
Anybody want to share anything?
I've been fucking Hunan House a lot recently.
Oh, all right. That's like right down the street, right?
Yeah.
Downtown.
They're fantastic. I think it's like the best Chinese in New Haven. Soup dumplings.
Really?
Mm-hmm.
Yeah.
Where is
Very
it?
good. It's like a block away.
It's like South Orange Street, I think.
Yeah. I just get it delivered. I haven't been to a restaurant in 9 years.
Yeah. It's kind of like authentic Chinese, let's say.
Yeah. Yeah. It's like a little bit better quality than regular Chinese.
Right.
Okay.
But it's not super upscale like that place on Chapel.
Oh, yeah.
No,
That's
no.
like a fancy restaurant.
No, not like that. There's not like 12-person tables. And
Yeah,
that
yeah,
kind of
yeah.
thing. Maybe they have those. I don't know.
No, they have. Yeah.
Again, delivery is my experience with them. So
Yep.
Okay. I think I'd fuck this new Indian restaurant. It's called, I'm going to say it wrong though. I think it's Lacis.
Where is it?
It's on Orange Street.
Oh.
Are
It's like
those
right next door or whatever?
I don't know if it's next door, but it's close.
Okay.
Have you heard of it?
No, can you spell it?
I think it's, can I look?
is that the one that's like all vegetarian?
Can you look at your phone? No. Stop. I mean, we can look it up too.
It's really good.
All right.
Like, it's really good.
I'm always down for new Indian
and
places.
it's so fresh and
I do like House of Naan. They got these.
it's good, but this is, I mean, I think this is.
These like curry fries.
Yes.
Pretty banging, yeah. Like
They
not
have
everything on that menu is great, but that shit is good.
They have okra fries, this place.
Okay.
And they're so
Oh.
good. Let's see, orders. So, it's Laziz. Lazeez.
Laziz. Yeah, sounds right.
It's
All
really
right.
good.
Cool. Check it out. Let's see. Mary. I mean, I guess I would marry maybe like Shell and Bones.
Oh,
I guess.
Really?
That's
Yeah,
easy.
I mean,
that's an easy one.
It's so good. You know, I love
Every day?
seafood. Well, I mean, is that what it is? I have to eat
That's
there every
what it
day.
is.
See that?
Every
Yeah.
single day.
I mean, yeah. If they still have an Impossible Burger, I could probably find
oysters
something
for
to eat.
breakfast?
I don't eat oysters
I
even,
love oysters.
but they eat seafood. Yeah, their brunch is good.
Yes.
Yeah, man, they got a lot of. Plus, you get the nice view. You know, that's where I bring a date when I know I already like her. You
Yeah,
know,
that's
like
a
when
big
you're
Oh,
like,
that's a big one. Yeah.
yeah, where you're like, oh yeah, let's go here. I once brought a date I did not know, and I was punished severely for that
Oh, yeah.
because like I told her I was against the death penalty, and then she spent a half hour explaining why it was important to kill people who were bad. I was like, oh boy, we really got into it.
Oh wow.
That's an expensive meal for that, right?
It was definitely spent a little more money than I should have, but you know. I squander money when you don't drink. That's how I think. I'm like, one night at the bar. What are you gonna do? Mm-hmm. You know, that's how
true.
I rationalize all kinds of behaviors. I'm like, what is that? 4 beers?
You count everything in beer cost.
Pretty much, yeah. Like honestly, because you save so much money not drinking. It's insane. So, all right, who else has got to love or marry? I should say.
Yeah, it can be a loveless marriage.
Yeah, that's right. Aren't they all, Colin? You tell us.
Right, I told Shelly one time we were talking about Bentara that used to be over here.
Oh, Bentara was
I
one of my
missed that.
faves.
Oh
Yeah.
my god.
And she was like, we had like just started dating. She said something about it. I was like, oh, that place is great. That's where you bring a date when it's like, things are going really well. And she's like, I've never
Been there.
been there.
Yeah.
Oh, no.
What the hell?
That's such classic Shelley.
Yeah, one day we'll go there.
Yeah. It was such a. I was so
I was
bummed
so
out when
sad
they
when it
closed.
left.
Yeah, they were great.
They were absolutely great.
So good. I guess my Mary would be. I mean, I think it might be like is Ivy Noodle. Is it still called that? Ivy Noodle?
Yeah, I think so.
This place that you can't remember the name of is the one you lay down
well, I
with
think
for the
they
rest of your
changed
life.
The name. Can they change the name? You know what I'm talking about. It's like an old school.
It's on Broadway.
Yeah.
Yeah, right next to
That or
Tomatillo
like a
or
pho
whatever.
place.
All
A pho
right.
place.
Yep.
Mm-hmm.
Any particular pho place or just any place?
I mean, was it Mecha or Mecca? I never know how
Mecha.
to say it. Mecha. I was in love with that place at the beginning. I'm not sure anymore.
Yeah.
I don't like
I'm
being
not a
there.
ramen
It was
person,
too
but I
cool for
like
me.
their
Yeah,
edamame.
it is too cool.
I agree.
Music,
And the music
was so
is
loud.
too loud.
It's
Yeah.
crazy.
too loud. I agree.
But I do love the food there. Yeah.
the
The
food's
food is
really
good. I think their broth is the best.
their broth is really good.
I like the ingredients for like the vegetarian ramen at the
Yes.
other place on Chapel or Crown.
Oh, yeah.
That's like near Firehouse or whatever.
Yeah.
But I feel like they have a better like ingredients for veggie ramen, but the broth is so much better at Misha. So if you combine them, you would have
Yeah.
a perfect. I'm gonna order from them both. Spend $40 on dinner. Fuck it.
Yeah.
You know,
I
like
spent
that.
8 beers on that.
You know, you get it. You're already there. You should quit drinking. It's fun. Yeah, it's fun math. What about you, Colin?
What's the name of the place on Broadway, the Indian place?
House? No.
Street.
Shere Khan.
Shere Khan.
You were very close.
You were. It
Yeah.
is street Indian food. Yeah.
Shere Khan. I went there recently to
It's good.
eat in there. It's totally different than getting it delivery. Eating in there,
Yeah.
it's like way better.
Yeah.
Um,
And it's like pretty affordable too. They have like a lot of really interesting dishes that you can try, and
yeah.
there's a lot going on there.
I would
Yeah.
I would marry them, and it's just like a cool place. They have cool artwork inside, and
Mm-hmm.
there's always something new. You know, that's what keeps a marriage exciting. You know.
Yep.
This is true. They're surprising you all the time, right?
Mm-hmm.
Mm-hmm.
Yeah.
All right. So who are we gonna kill? Always the hard part.
Local small business people.
I know. I'm ready for that one.
You ready?
You ready?
Yeah.
Drop it. Give it.
Michaelinas.
Oh, really?
Oh,
Yeah.
God.
What is Michaelinas?
Exactly.
It's a place that used to be where Delania's was.
Okay.
Yeah.
Okay.
So it's like a couple of Rhode Island guys, I guess, but they have like bikers that hang out there. I don't know. I heard. I don't know.
What's your beef?
There's such a thing as bad pizza in Connecticut now.
Wow.
Mm.
Wow.
Such-
Eamon's nodding his head too. So like this is apparently
Really?
a real problem.
It's a
Yeah.
thing.
I
Wow.
just outed him.
Yeah.
You can
sorry.
follow Eamon on NHV Free Artists.
I feel like, you're coming into New Haven, you can't half-ass it,
Mm-hmm.
right? Like,
And they're from Rhode Island. They don't
That's a
understand
thing.
anything. It's fine. I would actually kill Delania. Not
Really?
because I don't like. I just think it's overrated. Like I honestly, people are like you'll be like, oh, like New Haven's got the best pizza, modern, Sally's and Pepe's. People are like, what about Delania? And I'm like, shut the fuck up. Like, what are you saying right now to me? Like,
Are you that aggressive with it?
yes, I'm just tired of
Wow.
it. I'm tired of people weighing in and acting like it's even close to modern. Like you're being ridiculous.
Mm-hmm.
It's like it's much closer to kitchen sink than it is to modern. I'm sorry, but it's just like it's a fancy
yeah, it's
artisanal
gourmet.
place.
Yeah, you're
But
right.
it's like
gourmet pizza.
that's fine that you put fig on a pie. I don't care, but it's like not the same, you know.
Mm-hmm.
So
Fair.
that's all.
Okay.
It's more my resentment at dealing with people on social media. Plus, their social media is like really aggressive and weird. So like, yeah, I don't know. Like
In
they've
what
got
way?
into it with people.
It's all
like, they've
right
had to
wing?
delete. No, although what's that that hair place did that.
Oh yeah, they hosted a rally outside of
who
their
did?
storefront.
Oh, yeah, that's right.
It's
On
crazy.
State Street?
Yeah.
Yeah.
That was crazy.
What is it? What and Bones?
Skull and Combs.
Combs.
Skull and Combs. That's what it is. I was like, it's something like.
It's a great name.
It is. Yeah, and they have good.
You can tell that
haircuts.
business was built around the name. Like
Yeah.
someone thought of that name, they're like, we should open a barbershop. Yeah.
And they've got good haircuts, but I refused to go because the guy was like, I'm not shutting down. And I've got
Right.
my shotgun. I'm like, get the fuck out of
Yeah.
here, bro. Like, do you know where you have business? Yikes. See, I would kill Delaney out of just pure social media and just like annoyance at their fans. Because they just like, it's like one of those things where it's like ruined by the fandom more than anything.
Yeah.
It's fine pizza. I won't ever choose it number one, but it's fine. But yeah. Plus, their new location is like, ugh, the ceilings are too high. It's way too loud in there.
That design, what?
Yeah.
Okay.
So,
It's very strange in there.
I mean, because it was like a dry cleaner.
I know, but I think it could have been different.
Delicious.
Yeah, I probably could have done
I think I would kill Mamoons.
Whoa!
Really?
I haven't-
Whoa, that is
Whoa!
I haven't been there since pre-COVID, but the last few times I was there, it was just not doing it.
Wow.
Maybe I wasn't drunk enough or it wasn't quite late enough,
Oh,
but
wow.
it just wasn't doing it for me like it used to.
Yeah. It's definitely one of those things where I feel like there are certain things you can order. Like if you just get like the falafel pita or whatever, it'll be like $4 and it's fine. But as soon as you get like a plate, you're spending like $10 and you just get like a little bit more lettuce and like it's like now I'm getting ripped off and the line is so fine. So yeah, I don't know. All right.
Can I just change my Mary to Atticus?
Sure. Really?
Yeah.
Really?
I love
Atticus?
their sandwiches and salads and soups.
Really?
Oh, it's so good.
Huh.
What was
I
your
could have
previous
that every
Mary?
day. A
The
pho
Indian place you can, Pho place.
Yeah,
right.
that you couldn't
A
remember. Yeah.
non-specific pho
Well,
place.
I mean, I feel like you can't get bad pho.
Yeah. They probably could, but yeah.
I'd go for a Stop and Shop. I think I'd marry them.
As somebody who had Stop and Shop sushi for dinner last night, I'm not in a place to judge
Their
it.
sushi's great.
Yeah, it's fine. I mean, they don't make it in-house or anything, so I'm sure it's from
They
somewhere.
do. No, they do.
Really?
Yeah.
Yeah.
At least the one in Hamden, they have a Japanese man making the sushi.
I'm like, I go to the one in New Haven. I doubt they have a guy there doing it.
That's probably made by the guy in Hamden.
Probably, yeah. All right, one more game. And this is Mayor for a Day. So basically, we give you $1 million to do anything you want in New Haven. What would you do, Elizabeth Rathbun?
Oh, boy. So...
I would give it towards the signals to finally get my bike lane. Because these jerks, it's almost time to have Doug back in here to dress him down again.
Your bike light?
Lane.
Oh, your bike lane.
The
Yeah.
Edgewood bike lane
Yeah,
that
yeah.
was planned in 2014 or whatever that has not yet been started.
Yeah.
Well done.
Yeah, I don't know. This is selfish of me, but I think it could be powerful for everyone.
Clothes for you?
No,
Just all clothes?
no. I would like a community garden thing. I mean, I think plants
Yeah.
are really powerful. Like,
Yeah.
I think that's something that...
Especially those plants that kill people.
Oh, God.
Where would this garden be?
Well, I think I want it to be, like, part of the whole, like, connecting different parts of New Haven. I don't know. I feel like there's a lot of people who could potentially get to know nature and benefit from it that don't or can't or... and I think there's something to growing things that you grow yourself and eating them and like the sustainability. And I think it could affect people and the environment on a lot of different levels.
Go on.
Here's my plug related to this because I was just talking to my former alderwoman last night. They're doing a program right now where they will come plant a vegetable garden in like a raised bed, like a small raised bed. It's like 3x3. And I don't know if it's like high school kids or the ag school or something will come and provide all the soil and seeds and all that. And they want to teach, basically have kids get their hands dirty and grow some food at their houses. So you can find that on the internet using some of those words I just used. I don't know what it's called, but they're doing that right now in New Haven.
Yeah.
Wow, thanks for helping out.
Yeah, you just call up the number that they
Call up
provide.
the number that you don't have.
Yeah.
Or search the terms, some of which
It's
you
not
may
my
have
program,
used.
and I didn't know I was going to be plugging it.
That's awesome.
But yeah, it's a really cool idea.
Nice.
That's great. I would love that. I would love to make that bigger. And I think it would be part of therapy too. So that's a good story.
So we can't plug your practice because you're not
okay.
accepting patients, right?
I'm not. I'm full.
How many patients do
I
you
have
have?
a little Instagram account. You can.
Okay.
What's
your
many
Instagram
patients
account?
do I have? Probably like 40 to 50.
Whoa, that's
But
a
I
lot
mean,
of
I don't
people.
see them every week.
You must be
And I
barely
do
listening.
groups. I do groups.
Oh, okay.
No, I try to listen.
What's your Instagram?
Pause.process.peace.
Pause, as in like, I guess there's no other word. Pause.
Like not pause, but like pause.
Not bear paws.
Right.
No, like pause.
Say
like
again?
when you were told to stop talking, pause, just like that.
So it's pause.process.peace. And then I also have a plant psychology one, which is plant with E.
Plant with E?
That's me.
Plant with
Elizabeth. I get it.
Yeah.
All right. I was like, I don't understand. All right.
That's what
cool.
her friends call her.
You want to plug anything there, Colin?
I do.
No, I'm plugging that vegetable garden planting
like
that at least they're doing with the New Hallville Community Management Team and
Nice.
probably all around the city.
I will plug between2rocks.com and Sad Vegetarian Bachelor Instagram. I'm trying to
You're
bring that
still doing
back.
it.
I've been trying to bring it back, so I am a sad vegetarian. Well, mostly vegetarian. I don't put the clam chowder or anything on there. I do lie a little bit. Anyway, hopefully we'll start doing comedy again soon. Elizabeth, thank you so much for coming.
Thank you. It was fun.
Sorry about
great.
interrupting you several times. But
Thank you for being a good sport.
Yeah, no problem. And thank you so much for tuning in, and we will see you next time.
Bye-bye.
Bye.
Busy people and lots of yellies, Worcester hipsters and fed up townies. We have more than pizza in common, with 2 rocks for bookends. New Haven, New Haven, New Haven. Between 2 rocks.